Next, Mr. Williams, please, for 5 minutes.
Thank you, Mr. Minister. Thanks for being here. Canadian innovators stepped up when asked to solve the shortage of PPE in 2020. Distillers switched to make hand sanitizer and cleaning products. Canadian companies retooled and produced whatever was needed for the pandemic. However, Canadian companies like Eclipse Innovations in Cambridge, Ontario, has millions of respirators sitting on shelves as of this month, and they can't move them, while some nurses and doctors in Canada are still saying they lack proper PPE. Health Canada had announced a Made in Canada change for companies that met the National Institute for Occupational Health and Safety, NIOHS standards, to get Canadian PPE out the door. But so far, this PPE is sitting in warehouses and not in our doctors' and nurse hands because it was not properly communicated that the Made in Canada designation would suffice to local hospitals and healthcare settings. And those settings are still procuring PPE from international, not Canadian companies. Minister, what percentage of PPE procured by the federal government in this date is made in Canada?
Well, thank you very much for the question, and thank you for being there, MP Williams. I've yet to know you really well because you're a relatively new MP. Two things here. First, on the effort, considerable effort and success that manufacturers across Canada have had in procuring all sorts of equipment to Canadians, including, as you mentioned, personal protective equipment and 95 masks, surgical masks, many other tools. So that's the first thing of which we need to be and want to be very grateful for. So thanks for signaling that. The second thing is that as these pieces are delivered to provinces and territories, they're delivered on the basis of what their needs and their requests are. Officials work extremely well together to make sure
Minister, I really appreciate it. Just what percentage right now of Canadian PPE is bought by the federal government, procured by the federal government?
So that obviously depends on all sorts of equipment and particular tools. What I was going to say is that the actual use of those pieces of equipment depends obviously on the demand and the needs of provinces and territories.
Minister, I appreciate that. That wasn't my question, but I don't think you have that answer right now, and I'd appreciate to get that answer. My second part of that is in the communication of the Made in Canada, and at this point, hospitals and healthcare settings don't have that information, and so they're still procuring from international, not Canadian, and this is coming from Canadian manufacturers. What's being done about the communication hurting Canadian PPC manufacturers at this point?
Well, we're doing three things, and as you said earlier, very successfully. First is to encourage and support Canadian manufacturers in providing quickly and efficiently all sorts of equipment and tools that we were in need for COVID-19. The second thing we've done really well was to work with provinces and territories to deliver those different tools, pieces, equipments that they were in need during COVID-19. And the third thing that we're doing right now is to invest even more in the domestic capacity, both in terms of research and development and production capacity of Canadian manufacturers.
Okay, thank you, Minister. And what I'm hearing that you don't have those procurement numbers yet, but what I'm hearing from local manufacturers and from across Canada is that they're not able to get their PPE out. And we want to make sure the federal government is buying Canadian manufactured PPE because I think it's very important. So if you could just please put that out, let's make sure we have some communication. I think we want to help Canada be ahead of this, not be average. My second question, Minister, is I know that my colleague, Mr. Davies, has already asked some of this, but Novavax and Medicago offer made in Canada vaccines that are not only innovative, but can help vaccinate the world. The new news from Novavax is they're helping to develop a flu and COVID vaccine, but Novavax is still not approved in Canada. My question to you, Mr. Minister, as we've had $126 million of our money invested into the new facility in Montreal, and Minister Champagne said we'd be producing these vaccines in December, and they're not. When will Canada be producing its vaccines, made in Canada vaccines, sir?
Well, thank you. And here are a couple of brief things. First, it's exactly true that we are so fortunate to have had science in the last 22 months, saving hundreds of thousands of lives. And the contribution to science has been made in part and in large part by companies like Medicago, which is in fact in my hometown.
Minister, when will they be approved?
And of which obviously I am very proud. The second thing is that we need to be vaccinated, and I remind every member of Parliament.
Minister, when will they be approved?
So, and the third thing is that because we need to be vaccinated, each of every one of us, I will turn to Deputy Minister Lucas to tell us more about the approval process for further vaccines.
Well, Minister, I would love the Minister to answer yes. When will the vaccines be approved in the next month?
Well, that is a decision that is obviously made by independent, rigorous, very intelligent, outstanding experts at Health Canada. And I'll therefore turn to Deputy Minister Lucas for more guidance on that.
We're out of time. If it's at all possible to add a couple of brief comments, Dr. Lucas, go right ahead. But if you want to follow up with a written response that's more comprehensive, I'll leave it to you. You have, if you can respond very quickly verbally, go ahead.
Thank you. In regard to the regulatory submissions for Novavax and Medicago, the Health Canada dedicated regulatory teams for each submission are working very hard at these. They are dependent on information from the companies to complete those reviews, but we expect to be making decisions on both vaccines in the coming weeks.
Thank you, Minister.
Thank you, Dr. Lucas, and thank you, Mr. Williams. Next, Ms. Cedar.